Let me introduce Calibrate V. We make custom-dosed vitamins, customized by blood testing, priced for mass markets, convenient, affordable, precise. The vitamin-mineral supplement sector is a vast fragmented market driven by fear and uncertainty. Fear that something is needed, uncertainty that the need is ever satisfied. We satisfy this fear and uncertainty by embedding our blood test into a closed feedback loop. Using our embedded blood test and your biometrics, we custom formulate 90 days of the vitamins you need. After you take them for 90 days, we test your blood again to see how your body absorbed them. Like a thermostat, we adjust the dosage to compensate for your absorption, your dietary intake, and your environment. So you get not too much of potentially toxic vitamins, not too little of essential nutrients, but just right, the precise amount your body needs. At the heart of the closed feedback loop is our embedded blood test. We've been developing this patented blood testing process for over 10 years, in collaboration with foremost experts around the world. With it, you drop in the mail a blood sample you draw at home from a finger prick, using our mobile app and our personal medical device that is simple, convenient, precise, and affordable. This blood testing process has been developed by the founders of Calibrate V at Wellspring Clinical Lab. Wellspring holds 2 issued patents that protect the blood testing process and is filing additional patent claims for further protection. Wellspring has granted to Calibrate V the perpetual and exclusive right to embed the blood testing process into vitamin supplement products marketed in the US. Under this agreement, Wellspring will provide these blood tests to Calibrate V. The key innovation that makes our blood test unique is our patented method for making mass spectrometry affordable. Mass spectrometry blood test methods are at the top of metrology hierarchies due to their exquisite specificities. Up till now, they've also been among the most expensive. Our development has focused on reducing the cost behavior of mass spectrometry. With our patented method, we can dramatically increase the duty cycle of mass spectrometry and thereby reduce the cost by 1 to 2 orders of magnitude. With typical methods, mass spectrometry duty cycles are in the 1% range. With our patented method, we can increase duty cycle by about 50 times. We're developing our personal medical device so that untrained people can successfully draw a quality blood sample from a fingertip in the convenience of their home by themselves. The personal medical device is controlled by our mobile app through Bluetooth and uses Internet of Things onboard components. It employs onboard iris biometric scanning for positive identity binding of the blood sample to your identity, which is immutably secured in our blockchain identity service. Our marketing strategy first focuses on satisfying the need that current products fail to satisfy. By placing an affordable product that satisfies the fear and uncertainty that current vitamin-mineral supplement products fail to satisfy, we have the opportunity to disrupt the mature, well-entrenched VMS brands. Beyond the existing VMS market, our studies indicate the potential to expand the VMS market to users not currently taking vitamins, by focusing on major health concerns we uniquely satisfy, that the competing products can't satisfy. Finally, we can analyze and dose micronutrients to nurture health with specific focus on areas like thyroid health or hormonal health. Ask a person if they take vitamins. If they answer yes, then ask them how they know what vitamins to take. They will say something like, "I don't know, but I hope I'm getting what I need." If they answer no, then ask them why they don't, and they will say something like, "I don't know what I need." In our nationwide survey, 58% said they take vitamins and 42% said they didn't. In response to our product description, 69% of those currently taking vitamins expressed a positive intent to use our product, and 51% of those not currently taking vitamins expressed a positive intent to use our product. This nationwide survey of 558 consumers is consistent with the potential opportunity we have to both 1. Disrupt this vast, mature, fragmented market, and 2. Grow the size of the market. The first major health concern we target is breast cancer, the number 3 cancer killer in America. We appeal to the 89 million women over 35, with the University of California peer-reviewed study demonstrating that breast cancer survival rates are twice as high when vitamin D levels are high at the time of diagnosis. These 89 million women will want to be satisfied that their vitamin D levels remain high. Then we progress to colon cancer, the number 2 cancer killer in America. We appeal to the 170 million population over 35, with the analysis done by Tufts University School of Medicine and published by the Nature Publishing Group, explaining how this second most deadly cancer killer risk is reduced by up to 25% when vitamin B9 folate supplement is just right. It explains when vitamin B9 levels are low, colon cancer risk is increased, and that when vitamin B9 levels are high, colon cancer risk is also increased. Not too much, not too little, but what it describes as the Goldilocks phenomena. Just right is when colon cancer risk is reduced by up to 25%. These 170 million people will want to be satisfied that their vitamin B9 level is just right. Next, we appeal to the diabetic population, with a very interesting observation demonstrated at the University of Essex and Warwick Medical School that vitamin B1 in plasma is up to 75% decreased in patients with diabetes, likely contributing to neuropathy, one of the earliest and most widespread adverse effects of diabetes. The 22 million people with diabetes in America will want to be satisfied that their vitamin B1 levels are just right. We are formulating a clinical study to demonstrate that Calibrate V significantly reduces risk of colon cancer. The treatment group will be users of Calibrate V. The control group will be users of Wellspring's blood test. We are seeking a research collaboration with a top-tier research institution to lead and formulate this study. When demonstrated, patentable claims can be made for the treatment system, and FDA approval can be perfected. Blue oceans, as defined by best-selling business author Chan Kim, are vast uncontested market spaces where typical competitive factors are irrelevant. Blue ocean strategy is the pursuit of high levels of differentiation at the lowest possible cost. In contrast, competitors in red oceans compete head-to-head on common factors, such as price or preferences, largely occupying the same space or position in consumers' minds with little meaningful differentiation. Our closed feedback loop renders the existing competitive factors irrelevant and creates a vast blue ocean opportunity, the phenomena Kim describes in his best-selling business book. It is rare to find a product opportunity where the strategic canvas shows this blue ocean opportunity as distinctly as does Calibrate V. Blue oceans like this have unusually high disruptive potential. Highly disruptive products can create vast wealth. The current VMS market in the US is about $12 billion and growing at 3 to 4% per annum. Our forecasts are based on assumptions that Calibrate V will capture about 10% of the market within 5 years. While not highly disruptive, this does suggest a modest capture of the current market. While it is hard to conceive how incumbent products that fail to satisfy the need that drives the market will survive when a product that substantially satisfies the driving need is provided, we attempt to allow for how the market might shift in response to our feedback cycle. Perhaps other competitors will emerge, or existing incumbents may find ways to adapt and compete. While we believe our product can be disruptive, it's not completely unique, and we assume a competitive landscape will emerge. The market is a mature, fragmented market with lots of established brands that have various levels of loyalty. We can't predict with certainty how these brands will react to the potential disruptive effect of our closed feedback loop. There are medical practices that provide vitamin prescriptions based on blood testing. These doctors tend to be holistic or naturopathic practitioners. These services are usually very expensive, in the range of $300 to $400 each time blood is tested. Most health insurance in the US doesn't cover these services. Accordingly, these services are too expensive for mass markets and only compete in niche markets for wealthy, health-focused consumers. There may be other competitors that emerge. Bayes is a startup that appears to be launching a similar product. We understand that it uses typical blood testing methods and, as such, will require larger blood samples, more expensive and complex methods to transport blood samples, and higher costs. Our understanding is that its target price point is 3 to 4 times higher than ours. Our financial projections assume the price of $55 for 90 days of vitamins. The pricing objective is to target a mid-quality multivitamin product that would appeal to the mass market. Our modest market capture forecast suggests about $1.5 billion in revenues within 5 years. With a gross profit margin of 40% forecast, profit approaches $400 million at the end of 5 years. Valuation of startup businesses is highly speculative. Notable startup exits in the consumer product sector during 2016 ranged from 3.3 times to 6.5 times trailing revenues. At 3.0 times trailing revenues, Calibrate V's exit valuation could approach $4 billion. We have a rich team working on the project. Calvin Weiss, our president, and Gary Skilton, our CFO, have worked together in the past for more than 10 years and have learned to complement each other well. Bruce Boyer, our board chairman, has been working with Mr. Weiss for nearly 5 years. All of our advisors have been involved with the project for more than 5 years. Each bring extraordinary, rich experience to this exciting opportunity. Our timeline projects development from the point when we obtain our pilot funding of $500,000. We expect to launch the pilot product within 2 to 3 months of obtaining the pilot funding. The build-out of production lab will progress throughout the pilot product period. It involves transferring our methods from the world-class collaborating research labs, where the research for them has been largely performed, into our own production environment. The initial blood test for the pilot product will be vitamin D. At the beginning of the pilot period, the blood test will be performed using an off-the-shelf commercially available vitamin D test, while our methods are being built out in our production lab and paralleled and validated with the commercial blood test. During the pilot period, we will validate our production implementation. We will operate within the constraints of the commercial blood test, related to sample volume and sample transportation. The sample volume constraint limits us to adding additional blood tests. It will be vitamin D only while we validate against the commercial blood test. The sample transportation constraint requires temperature control during transportation, such that our mailer system will not be feasible. When our production lab implementation is sufficiently validated, we will engage in the bioengineering needed to increase the number of blood tests and begin using our mailer system for transportation of the sample. We plan to launch the market product when we have at least 2 vitamins included in the blood test and when we have sufficient funding on hand. The amount of funding required for the market launch is dependent on the rollout strategy, which has not yet been optimized. The required studies and planning for the rollout will intensively ramp up during the pilot product period. Our current expectation is that the market product launch will require $8 to $10 million in funding, and that it will proceed within 10 to 12 months of the pilot product launch. In summary, Calibrate V has the potential to disrupt a massive fragmented market. It has patent protection for the key innovation. It has a seasoned, innovative and cohesive leadership team. The product will be in the market soon. And there is a strong case for demonstrating significant medical claims that are both patentable and FDA approvable.